Hello, doctors. Today we are going to discuss a very important topic, that is the role of obstetricians and gynecologists, that is OBGYN, in managing a patient. So, as we know, this specialty is very unique because it deals with two interconnected but are different areas, like obstetrics, which is the pregnancy and childbirth, and gynecology, which is the study of the female reproductive system in health and disease. So, unlike many other branches of medicine, here in OBGYN, we are managing two lives at once, like the mother as well as the baby. So, this makes the responsibility of an OBGYN even more crucial. So, we will look at how we can contribute in OPD care, IPD management, preventive medicine, and as well as the emergency interventions. So let's move forward to the topic. So the obstetricians and gynecologists, also we can call as an OBGYNs, play a very important role in women's health. Also, like in all across all the stages of the women's health. In adolescence, they help, like OBGYN help with the menstrual problems, anemia, and reproductive counseling. And in reproductive years, they are involved in antenatal care, childbirth, contraception, and infertility treatment. Later in life, they also manage the menopause, osteoporosis conditions, and cancer screening. So, the scope is not restricted to only the pregnancy alone here. And also remember, the OBGYN work happens at two levels, that is the OPD level as well as the IPD level. In OPD level, what we does is mainly preventive and diagnostic and follow up, and IPD level mainly the pregnancy, surgical procedures, and the emergency care. So it involves both the OPD and IPD management. The role is not limited only with the pregnancy or the labor and with the mother. It's also involved the both the mother and the baby in OPD level and IPD level. Moving on to the scope of obstetrician and the gynecologist. So the scope of OBGYN is very like broad. First one is antenatal and postnatal care. So here this includes the routine monitoring of mother and baby, identifying any higher risk pregnancies, and ensuring the safe recovery after the delivery. Second is the deliveries, that is normal and complicated deliveries. So, from vaginal normal deliveries to complicated cases like obstructed labor or breech presentation, the scope is also present here. Third is the gynecological disorders like fibroids, ovarian cyst, endometriosis, PCOS, PID, that is pelvic inflammatory disease. So, these are the gynecological disorders where there is a role of OBGYN. Next is the infertility and reproductive, like health, evaluation of the couples, ovulation induction, assisted reproductive technology. So these comes under the infertility and reproductive health of the women and both the couples. And next is the preventive oncology, that is cervical and breast cancer screening. So pap smears, breast examination, HPV vaccination, and early detection of ovarian endometrial cancer. So these are the scope where an OBGYN have in the preventive oncology. So this is the wide scope which makes the OBGYNs one of the most multidisciplinary specialties. So they need surgical skills, medical knowledge, emergency handling, and preventive health expertise. Next is the clinical role in OPD. So what is the role of an OBGYN in OPD clinically? So in the OPD, the OBGYN has the maximum interaction with the patients. So here the focus is more on early diagnosis and preventive medicine and continuity of the care. First is the routine antenatal checkups. So routine antenatal checkups will do monitoring of the weight, blood pressure, urine for protein, hemoglobin, and fetal growth. Next is the family planning and contraception advice. So, counseling the women and the couples about the contraception, family planning, pills, IUCD, barrier methods, or sterilization, etc. Next comes the menstrual problems. So, managing the heavy bleeding, irregular cycles, amenorrhea, dysmenorrhea, menopause, menorrhagia, etc., comes under the menstrual problems. Next, we'll do is the gynecological evaluations like pelvic examination, pelvic pain, abnormal discharge, recurrent infections. These are done in the gynecological evaluation. Last one is a preventive screening. That is, as I have mentioned in the previous slide, pap smears for cervical cancer, breast examination for lumps, and advice on the HPV vaccination. So, this is the clinical role of an OBGYN in the OPD. So, what are the things where the OBGYN does in the OPD level? So, OPD is where we can prevent the complications before they reach the emergency level. Next is the OPD management or prescription. What we can do to the patient, what advice can be given to the patient at the OPD level of management. So, management in OPD is usually medical and supportive. So, in antenatal care, we can advise the patient to start with the folic acid in the first trimester, followed by iron and calcium supplements later. High risk cases may need aspirin, for example, in case of preeclampsia prevention, we can advise aspirin. So, these can be done in the antenatal care of OPD management. Next is the pregnancy induced hypertension. So, this case in the OPD level we can manage by starting antihypertensives like labetalol or methyl dopa. And next, third is the gestational diagnosis. So, how you can give the advice, manage the condition OPD level of gestational diabetes by prescribing the diet and exercise first, and then the oral supplements or oral medications or insulin if needed. Next comes the contraception like OCPs, IUCD, injectables. So we can prescribe oral OCPs and IUCD injectables depending on the patient's stability. Then last one is lifestyle and diet counseling. So as a doctor, as an OBGYN, you have to be aware of the diet and exercise, weight management in PCOS, and even as well as the perimenopausal women. So it is very important to know all these things so that you can advise the patient on the OPD basis and do the management of the condition. So here the OPD management goal is like to prevent the any emergencies or any other more any other different cases, any complications, to early diagnose the condition, and also the patient education. So these three are done in the OPD level of the patient. So as an OBGYN, you should be aware of knowing all these things in the OPD level. Moving on to the clinical role of the OBGYN in IPD. So in IPD, what is the role of the OBGYN? What is the clinical role? So when a patient is admitted, the role of an OBGYN shift towards the intensive monitoring like an emergency management and surgical care. So first one is labor and delivery management. So conducting the vaginal delivery, any assisted delivery with the forceps or vacuum, and cesarean sections when required. Next is the high risk pregnancy. So, managing the preeclampsia condition, eclampsia, gestational diabetes, placenta previa, multiple pregnancies, etc., can be done in the IPD level. Next comes the obstetrics emergencies, emergency obstetric care like for a postpartum hemorrhage. It is one of the most important leading causes of maternal mortality. So that case, and ruptured ectopic pregnancy, it requires an immediate surgical intervention. So that is one of the case under the obstetric emergencies. Septic abortion, so it requires antibiotics and evacuation. So this comes under the emergency obstetric care. Next is the gynecological surgery. So the gynecological care, for example, like hysterectomy, myomectomy, ovarian cystectomy. So these conditions can be only done or managed on the IPD basis only. So these are the gynecological surgeries as an OBGYN you should be aware of in the IPD level. Last one is the post-operative care. So after the operative session, you have the post-operative care. This should be also be done as an OBGYN in the IPD basis only, like pain management, infection prevention, and monitoring for any complications. So in the IPD, we will be doing the life saving and surgical procedures in the IPD basis. How we can manage the patient at the IPD level of management. So in IPD management, the protocols are more in a multidisciplinary way. So first one is supportive care. You have to advise IV fluids, oxygen, blood transfusion, antibiotics if required and needed. Then you should be aware of the emergency drugs like magnesium sulfate in eclampsia, oxytocin for postpartum hemorrhage, then broad spectrum antibiotics and sepsis. So that is the emergency drugs in the IPD management. Surgical intervention. So surgeries like cesarean section in any obstructed labor, hysterectomy in uncontrolled bleeding or malignancy, then DNC, that is dilation curettage for any retained products of conception. So these are the surgical interventions in the IPD management you will be doing as an OBGYN. Next is the monitoring. So how we have to monitoring, what should be done in monitoring the patient, that is maternal vitals, fetal well-being, urine output. So these are the things you will be doing in the monitoring of the patient, the IPD management. Next comes the post-operative care. So post-operative care, under that you will be advising antibiotics, analgesics, wound care, early ambulation or any thromboprophylaxis can be done given in the post-operative care. So the most important principle of an IPD is act fast, stabilize mother, save both mother and baby. So as I have discussed before in the previous slides, the principle of an OPD is early detection and diagnosis, prevention and patient education. So that three is important in the OPD management. When it comes to the IPD management, you should be acting fast and quick. You have to stabilize the mother and save both mother and baby. So this is the thing, most important principle in the IPD management. Moving on to the important investigations. So investigations are very important to rule out any condition. So as an OBGYN, you should be aware of all the investigations, so that it will be very easy for us to do the management plan. So how we can guide the patient throughout their pregnancy also, and also throughout their consultation and all. So very important is the investigation. You can advise routine blood tests like CBC for anemia, RBS, and for any gestational diabetes, blood grouping and cross matching for any transfusion. So these can be done in the routine blood investigations. Next comes the urine test. So urine analysis is also important, that is proteinuria, for example proteinuria in PIH. In PIH is the in proteinuria detection in preeclampsia, and any infection screening also can be done in the urine analysis. Next comes the ultrasound. So scan. So in ultrasound we'll give dates like dating scan in the first trimester. So anomaly scan at 18 to 20 weeks, then growth scan in the third trimester. So these are the scans we'll do for the fetal well-being, and the Doppler also for fetal well-being will be done. So these are the ultrasound for investigation you will be doing as an OBGYN to the patient. Next is the pap smear. So it is very pap smear is an essential, it's very important for a cervical screening, cancer screening. So that should be also done in the investigation. Next is the tumor markers. So tumor markers like CA125 for any ovarian malignancies, especially in the women with adnexal masses. So that is very important. You should be aware of the tumor markers as an OBGYN. So these all investigations which will help us in our clinical practice. So it will be helpful for us to differentiate between the low risk and the high risk patient. So if the patient comes under the low risk category, you can diagnose and manage the condition the OPD basis. But when after the investigation, if you rule out that it is an high risk patient, then obviously you should be sometimes require an IPD admit level treatment, like you have to admit the patient and give their necessary care and support and medication management to the patient. So investigation is very important to decide whether we have to treat the patient and manage the condition the OPD level or the IPD level of management. Next is the preventive and counseling role. So, the most effective role of an OBGYN is in prevention counseling. So, first one is pre-conception counseling. So, here we'll do the correction of anemia. We'll advise the control diabetes and thyroid disorders, and we also advise to start the folic acid. Next is the lifestyle modification. This is very important in PCOS, obesity, and infertility. So we have to advise the patient to do a lifestyle modification while counseling the patient. Third is the cancer screening. So cancer screening, cancer prevention, so HPV vaccination in young women, and we have to also advise the patient to have a pap smears every 3 years, and encourage the breast self examination also. Next comes the menopause counseling and HRT discussion. So here we have to explain the patient regarding their hormonal changes, risk of osteoporosis, and discussing hormone replacement therapy, that is the HRT. So when needed, so these can be done in the menopause counseling, and I have to explain the patient why it happens, what are the physiological changes, what it is happening in their body. So these comes under the preventive and counseling a role of OBGYN under the menopause counseling. Next is the last one is safe motherhood awareness. So you should be very knowledgeable to educate the women about the importance of an antenatal visit, and identifying any warning signs like bleeding or severe headache or anything, promoting the institutional delivery and breastfeeding practices. So these are be done to give an awareness to the patient about for the safe motherhood. So important as an OBGYN is a good, it's like you should be knowing that a good counseling can reduce many complications more than any medicine. So instead of, maybe there will be cases where the patient needs a good counseling rather than medication. So you should be aware of all these things, the important things to be noted while talking with the patient or dealing with the patient's clinical history or medication history and all. Sometimes the patient may need a good counseling instead of a long list of medicines. So that is the importance of the OBGYN in the preventive and counseling, as a preventive and counseling role in the health, in the life of a women's health. So moving on to the conclusion of our today's topic. So to summarize, the role of an obstetrician and gynecologist is very important. It is very multidisciplinary. So we are not only doctors, but who only deliver the babies, but we are also a lifelong caregivers for the women's health. So in OPD basis, you should focus on the prevention of the disease or the condition, and diagnosis and counseling the patient and educating the patient. In OPD, in IPD level, you have to handle the critical emergencies, surgeries, and life-saving interventions. So by doing both these, we can significantly reduce the maternal and neonatal mortalities and improve the quality of the life for women, and promote the, as well as promote the preventive health. So we can say OBGYNs are not just a specialist, but they are a very important pillar in when it comes to the health care of a woman. So as a OBGYN, you have both the roles in OPD as well as the IPD level. So I hope you got a clear picture or idea of what is the role of an OBGYN in their in the women's health and managing the patient. Hope it's clear. So we'll wind up today's topic. Thank you for patient listening. Thank you.